When do nightmares become nightmare disorder, and what do you do about it? Do you ever have dreams about being chased, or your teeth falling out, or suddenly having an important exam that you haven't studied for? Nightmares can be extremely distressing and can disturb sleep. And if you are a physician or a therapist, it can be really challenging to know how to help your patients experiencing nightmares. If you're interested in sleep and mental health, go ahead and subscribe to this channel so you can keep on learning about integrative holistic strategies to optimize sleep and mental well-being. I'm Dr. Nishi Bhopal. I am a physician specializing in psychiatry and integrative medicine and sleep medicine. Every video contains a tip for healthcare practitioners and is eligible for CME credits. And before we jump into this video, physicians, I do have a free sleep mini course for outpatient doctors that is jam-packed with high-yield tips. You can go ahead and grab that at intrabalance.com/doctors. Okay, so this is part 1 in a 4-part series on parasomnias, and we're actually going to do 2 videos on nightmare disorder, so this is part 1 of the 2 videos on nightmares. So in this video, we're going to talk about how common nightmares are, we're going to look at some of the symptoms, and then there's a tip for differential diagnosis for healthcare practitioners. And then in part 2, we're going to go into how do you actually evaluate someone for nightmare disorder, and then how do you actually treat it. Nightmares can be really tricky to deal with, whether you're struggling with them yourself or you're working with patients who have nightmares. When I was in my sleep medicine fellowship, I distinctly remember this young woman who came to clinic because she had these horrible, debilitating, really disturbing nightmares that were having a huge impact on her sleep quality and her day-to-day functioning, and it was creating a lot of anxiety for her. And there was no specific underlying cause, but it was just having such a pervasive effect on various aspects of her life. So these nightmares were incredibly distressing for her, and she was really coming to our clinic looking for some relief. So in this video, we'll look at some of the ways that we would evaluate somebody like this, and then in the second video, we'll look at some treatment options for a patient like this. How common are nightmares? About 85% of adults report having a nightmare at least once a year, but about 2 to 6% of adults report having frequent nightmares, which is classified as at least once a week. As far as children, approximately 50% report ever having nightmares, and about 20% of kids report having frequent nightmares. Women and adolescents are more likely to report nightmares, but for younger children and adults over the age of 60, there's actually no gender gap between who's reporting more frequent nightmares. What exactly is a nightmare? There's a difference between a nightmare and then a bad dream. So a nightmare is characterized by incredibly vivid, disturbing, and distressing dreams. They seem really real, and people usually remember them in vivid detail. They usually involve very strong emotions like anger or fear, but other emotions can be prevalent as well, like disgust or anxiety or embarrassment. They usually involve certain themes, like themes of danger or themes of failure or feelings of helplessness or themes of conflict. And a key feature of nightmares is that they actually wake the person up and disturb sleep, whereas in a bad dream, the person may not wake up from the dream. Nightmares generally happen during REM sleep or rapid eye movement sleep, which is more common in the second half of the night. Now, there is an exception with PTSD or post-traumatic stress disorder, where the nightmares can happen during non-REM or REM sleep. So they may happen with PTSD in the first half or in the second half of the night. And then when do nightmares actually constitute nightmare disorder? So nightmare disorder occurs when the nightmares happen on a regular enough frequency to disturb the person's daytime functioning or their sleep quality. If information like this is helpful for you, then go ahead and click the like button. All right, let's talk about 5 main causes of nightmare disorder. Number 1 is trauma, and the trauma can be physical trauma or it can be emotional trauma. And the nightmares where a person is reliving past traumatic experiences, these are a cardinal feature of PTSD. Like I mentioned before, PTSD-associated nightmares can happen during non-REM and REM sleep, meaning they can happen early in the night or late in the night. So PTSD-related nightmares might cause difficulty staying asleep or waking up too early, but they can also cause trouble with sleep onset or falling asleep, and can contribute to symptoms of insomnia. The second cause of nightmare disorder are psychiatric conditions like depression or anxiety or bipolar disorder, and PTSD also falls into this category. This is really important because people who are experiencing frequent nightmares are at a higher risk of attempting suicide or engaging in self-harm behavior. In people who have depression, you do see alterations in their sleep architecture, where they have reduced REM latency, meaning they go into REM sleep sooner, and they also have changes in their REM density, meaning they have more REM sleep. So this might contribute to the increased rate of bad dreams and nightmares in people who are experiencing depression. The third cause of nightmare disorder is actually medication. For example, blood pressure medications, also known as antihypertensives, can contribute to nightmares. These include medications like beta blockers, so things like propranolol or metoprolol, which are considered lipophilic beta blockers. These can contribute to nightmares, but hydrophilic beta blockers like atenolol can also be a contributing cause. Dopaminergic drugs like Adderall and Ritalin can also contribute to nightmares. And we looked at how psychiatric conditions can contribute to nightmares, but the medications used to treat them can also be a contributing factor. Antidepressants like SSRIs and SNRIs and other classes of antidepressant medications can also contribute to nightmare disorder. So when you're treating patients with these conditions, it's always a risk-benefit analysis to see what treatments are appropriate and what treatments are not going to actually exacerbate the underlying condition. And then certain antibiotics can also contribute to nightmare disorder. For example, medications like ciprofloxacin or erythromycin may modulate cytokines involved in sleep regulation, which may contribute to nightmares. The fourth cause of nightmare disorder is medication withdrawal. And this is especially true for GABAergic medications or substances like benzodiazepines, so your Ativan, Xanax, Klonopin type medications, and also alcohol. Withdrawal from antidepressant medications may also contribute. Then the fifth cause is idiopathic, which means there's no specific identifiable cause. We do know that nightmares may increase during times of stress. And sleep research has shown an increase in nightmares and bad dreams during the COVID-19 pandemic. All right, and here is your tip for healthcare professionals. 8 differential diagnoses that you want to consider when you are seeing a patient complaining of nightmares. Differential number 1 is bad dreams or dysphoric dreams. Differential number 2 is REM behavior disorder, which is associated with movements or vocalizations during dreams. Differential number 3 is sleep terrors. The difference with sleep terrors is the person typically doesn't remember the event, and it usually happens during non-REM sleep. Differential number 4 is nocturnal panic attacks. These are not associated with the dream, unlike nightmares, and the person usually wakes up in an extreme state of panic. They might even feel like they're having a heart attack. The physical symptoms are that severe. Differential number 5 are hypnagogic and hypnopompic hallucinations. Differential number 6 are bereavement-related dysphoric dreams. Differential number 7 are lucid dreams. The person is aware during the dream that they are actually dreaming. Differential number 8 is sleep-disordered breathing. For example, in obstructive sleep apnea, people may experience a choking sensation or difficulty breathing because of airway collapse, and this may result in nightmares of feeling suffocated. For example, someone might have a nightmare that they're drowning. Now, in our next video on nightmare disorder, we are going to look at how to evaluate nightmares, and then we're going to look at some treatment options, including conventional approaches and some approaches from integrative medicine. Now, what was your biggest takeaway or aha moment from this video? Let me know in the comments below.